Welcome to the Victorian and Tasmanian PHN Alliance Education Webinar Series. This webinar is on the coordination of care and service navigation. Hello, my name is Paresh Dowda. I'm a practicing GP in Canberra with a practice entirely focused on providing outreach care to older people and those with complex and chronic needs. I also work at the New South Wales Agency for Clinical Innovation and New South Wales eHealth as a consultant GP specialist advisor. I have academic affiliations at a couple of universities and am the editor-in-chief for BMJ's Integrated Healthcare Journal. And care coordination is a significant enabler for better integration. I'm delighted to be joined by Gary Smith. Gary, may I ask you to introduce yourself?
Thanks, Paresh. I'm a practice manager over 36 years of a 12-doctor-owned general practice at the foot of the Blue Mountains in the west of Sydney. I am chair of QIP and a director of AgPal. I'm a co-surveyor for AgPal, and I'm an academic director for Uni Partnerships. I'm a director of my local PHN and local health district as well. Thanks, Paresh.
Thank you, Gary. Let's start with an acknowledgement to country. We acknowledge the Aboriginal and Torres Strait Islander peoples as the traditional owners of the lands. We wish to pay our respects to the elders, past, present, and emerging, and acknowledge the important role Aboriginal and Torres Strait Islander people continue to play within our community. This webinar has been developed by Eastern Melbourne PHN on behalf of the Victorian and Tasmanian PHN Alliance, which is a collective platform for the 7 PHNs in Victoria and Tasmania. The webinar was made possible with funding support from the Australian Government Department of Health. The Commonwealth of Australia, Eastern Melbourne PHN, and the participating Victorian and Tasmanian PHNs do not accept any legal responsibility for any injury, loss, or damage suffered as a result of the use, reliance upon, or interpretation of the information contained in this webinar. This webinar is to be used as a guide only, and practices should read and refer to the accompanying additional resources and references. In this webinar, we will focus on 3 aspects. Who are the patients that will benefit most from coordination of care? What are the elements or components necessary to do coordination of care? And what can we do in our practices to help us improve care coordination? Throughout the webinar, we will be talking about the what, covering the concepts, evidence, and knowledge. As we talk about the what, we would like you to consider the so what. So what does it mean for you, for your practice and workplace? By the end of the webinar, we would ask you to consider the now what. Having heard from us and considered your context, we hope you will have 1 or 2 ideas to test out in your practice. The now what is what will make the difference to your patients from this webinar, and so it's an important outcome of this webinar. Let us start with the patient. If we were to ask a patient what is important for them, what would they say? In the UK, the National Voice Project did just that. They asked patients what was important to them with respect to integration of care, and patients said, I can plan my care with people who work together to understand me and my carers, which allows me control and brings together services to achieve the outcomes important to me. This includes things like having goals, information, being involved in decision-making and care planning, and communication with them and between the care providers involved in their care, so the transitions of care are smooth. Gary, I wondered if you had any upfront comments on care coordination.
Yes, thanks, Paresh. I think the main goal of care coordination is to meet patients' needs and their preferences in delivering high quality, high value healthcare. And I know you are going to address the how in this presentation.
Thank you, Gary. So, despite the aspiration from patients, a significant minority of our patients still experience care coordination gaps. This is a survey of GPs, and it shows in Australia over a quarter of our patients experience care coordination gaps. A more recent survey done last year, again of GPs, gave much more detailed information on elements of care coordination gaps. It shows many care coordination gaps in relation to the transfer of information between different care providers, including emergency departments, hospitals, after-hours providers, home care, and community nursing providers. This is really rather concerning, particularly for our population as they get older and have more complex needs, and therefore who may need much more support with care coordination. When we look at our population, particularly those with chronic conditions, what we find is that the majority are low risk, about 80%. For this group of people, health prevention and promotion is important. They don't really need care coordination, but what they do need is having connections and linkages made for them, and that's as important as ever. The next tier, about 15% of our population are at moderate risk. They may have one or two chronic conditions and other risk factors. They need help and support with managing their condition, and some of them may need care coordination, but for many, linkages still may be sufficient. This will depend on their level of enablement or activation, and an important aspect of what we do should be to support their enablement. The health literacy of our patients and any carers will significantly impact on their ability to manage their chronic condition and inform the degree of assistance they require with their care coordination. However, as we move up the triangle, the risk becomes more significant, and people in those tiers are more likely to benefit from care coordination and help with navigating the maze of services, be they health or social. Let's just take a step back for a moment and think about what we call the health ecosystem. We have patients at the very center surrounded by people that help support them, like family and carers. Surrounding that are general practices and other primary care services and social care services. And the final circle is the hospital specialist sector. At different points in a person's health journey, patients have to move across these different providers who are at different levels within the healthcare system. In this journey, there is one constant, and that is the patient, their family and carers, and in most cases, their GP. Hence, the role of GP in the coordination of care is critically important. Gary, I wondered if you had any comments on the health ecosystem.
I do, Paresh. I think the main challenge is that we're confronted with as the general practitioner or the general practice, as you had just indicated, as being the gatekeeper of patients' healthcare, is how do we transcend across all facets of the health ecosystem and continue to provide good continuity of care to the patient, knowing or not knowing the complete healthcare journey of the patient. That's the challenge.
Thanks, Gary, for setting that challenge for us. So I guess the question that emerges is, how can we do care coordination better? The McCall Center for Healthcare Innovation in the US has produced a care coordination model based on their experience of working with many primary care services. This care coordination model has 4 components. First, patient support. Second, connectivity. Third, relationships and agreements. Fourth, accountability. Let's take a look at each one of these in turn. Let's start by looking at patient support. What do you do in your practice to help support patients in their care journey? Do you have a specific person in your team that undertakes this task? How do you decide which patients need support? And how do you support patients to achieve higher levels of enablement or activation? Do you follow up on referral and discharges following hospital admission? These questions are designed to stimulate your thinking about what you do to support patient activation. You and your practice teams may already be doing some of this, but we can often do more. Firstly, are you able to identify patients who would benefit most from care coordination? Are you able to mine your data in a way similar to the pyramid we saw earlier, so you can identify which of your patients are in which tier? Do you have access to a clinical audit tool like Polar or Pencat or MD Insights to assist you to do this? You could measure patient activation and/or enablement using tools. The Coordinated Care Program from the DVA is a program specifically designed to support DVA Gold Card holders who would benefit from care coordination. Have you enrolled patients into that program? Often, identifying a key person within the team to take on the role of care coordinator is helpful. This may be the practice nurse, but doesn't always have to be. Which patient do you ask your receptionist to help with in booking appointments for them with other providers? Following up patients after discharge has been shown to reduce readmissions to hospital. Do you follow up patients after discharge? And if so, when they attend the practice, what do you do? Do you have a checklist of things? And do all doctors in the practice do the same thing? How often will you reconcile the medications against a discharge list and update the medication list on your computer system? If there has been a new key diagnosis, do you add that and update your patient summary? Do you record the hospitalizations so you can measure how many of your patients are hospitalized and how frequently? Let's move on and look at connectivity. The transfer of information is a critical component of care coordination. Increasingly, there is desire to ensure this transfer happens electronically and securely in a timely way. When we look at the study we discussed earlier, done last year, and the care coordination gaps, this showed information transfer was a deficit in so many instances. There have been initiatives in Australia to try and improve information transfer, such as My Health Record, and secure messaging systems like HealthLink and Argus. Connectivity refers to information transfer aspects, and the questions we pose suggest opportunities for actions to help improve connectivity. How do you communicate with other providers? How can you improve this? Do you have agreed processes for information flows? What is the quality of your referral letters when referring patients to other clinicians? How do you share information with your patients? How do you share care plans in particular? Ensure you are receiving correspondence from all providers involved in team care arrangements after each session. Let's think about relationships and agreements. In terms of coordination of care, having relationships and agreements with other providers, community care providers, and hospital services can facilitate improved coordination. Looking at your practice population and their needs can help guide how you prioritize relationship building and agreements. For instance, in my practice, we work with lots of older people who are housebound, frail, people with disabilities, and those with palliative care needs. We have therefore built strong relationships with some of the community care providers, NDIS providers, and palliative care services. We have agreed common arrangements and how they can escalate care if they are concerned about a mutual patient or client. We have also identified non-government agencies. For example, there's an NGO that supports carers and relatives of those entering end of life. This sort of social prescribing can be really very helpful for patients and their families. These relationships and agreements can also help clarify the roles and responsibilities across the care pathway. Sometimes these relationships and agreements are engineered at a system level. Health pathways can provide evidence-based guidance on the assessment and management of a range of conditions and local referral advice. It can help you to find local providers and clarify their roles and responsibilities. See the resource page at the end of this webinar to access your local health pathways. And finally, let's look at accountability. Accountability is critical for care coordination. In many health systems, no provider takes ownership and accountability for coordinating care. This leaves patients loose to do their own coordinating. Some patients may be able to manage this, but not everyone can. As a practice, consider where you are in your feelings about taking ownership of care coordination. Once this is done, how do the systems and processes in your practice support coordination of care? As you can see, there are some suggestions on this slide for you to consider. How will you monitor and track referrals to other providers and for diagnostics? How will you ensure clinical information, key diagnoses, medication lists are all up to date? Do you undertake a medication reconciliation after discharge? Do you follow up people after discharge as a matter of routine? As we come to the end of this webinar on care coordination, let's just reflect back on the patient and their perception. Remember, care coordination is about achieving this from the patient's perspective. For us to achieve care coordination requires us to take a degree of accountability and develop relationships and agreements with other care providers. We need to make sure we reliably play our part in the information transfer and support patients to coordinate care better.
Thanks very much, Paresh. I think there are two challenges for me in regards to coordination of care. I think the first one is being around health literacy of our patients. Do they have the skills or knowledge to understand and use information to make decisions specific to their healthcare? And secondly, it's the age-old problem of interoperability of systems, which allows all parties in a patient's health journey to be able to receive information in a timely manner and in a format which everyone can access to allow effective and complete care coordination.
Thanks, Gary. All very real challenges we all face on a day-to-day basis. So as we come to the end of this webinar, what we have talked, we've talked about the what. As we've been talking about the what, we hope you've been reflecting on the so what. What does this mean for you and your practice? Now it's time for you to commit to a couple of actions. What will you do next? What is your now what? Remember, it can be pretty simple. Throughout this webinar, we've raised lots and lots of questions for you to consider. Each one of those questions could be translated into an improvement activity. We encourage you to pick at least one of such activities from different components of the coordination support model. This slide shows you the link to your locality-specific health pathways. Here are a number of resources for further information on care coordination. The first hyperlink provides additional information and is the model on which the majority of this presentation is based. This now completes the webinar. Any feedback or future support on the webinar should be directed to your PHN. Thank you.